GAA concussion guidelines are that concussion is a brain injury which must be taken seriously. On suspicion, a player must be removed from the field of play and should not return on that day. The player subsequently should be monitored because concussion is an injury in evolution and should be cleared by a doctor before returning to play. The important message for GAA members in relation to concussion is that a concussion diagnosed and managed appropriately does not have long-term consequences. A concussion that is not diagnosed and not managed leaves the player at risk of subsequent injury, including repeated concussions or second impact syndrome, problems such as depression, anxiety, mood disturbances and cognitive impairment.
Well, we have given great consideration to the concept of a concussion sub, and Congress decided to refer the matter to the MSW committee to come back with a recommendation. And we have decided, having given it lots of consideration, that there shouldn't be a concussion sub. Our main reasons for doing this is that the fundamental principle of the GAA's concussion guidelines is that if there's a doubt or suspicion about concussion, that the player should be removed from play. The principle is, if in doubt, sit them out. Non-contact injuries account for the vast majority of injuries in Gaelic games. About 70% of injuries in football are non-contact. GAA 15 is an injury prevention warm-up routine, and it's designed as a 15-minute warm-up routine that should be done in advance of training sessions. And we believe that if we can educate our players, particularly our younger players, to become accustomed to this warm-up routine, that it will reduce the risk of injury.
The GAA defibrillator scheme has run since 2007, and it allows clubs to purchase an AED unit at a discounted price from our partners Heart Safety Solutions. The exchange programme enables clubs whose unit might be falling out of warranty to purchase a new unit at a further discounted price when they trade in their old unit. Blood testing is being introduced as part of the GAA's anti-doping programme in conjunction with Sport Ireland on the 1st of January 2016. We want to protect the image of our games and make sure that all players are competing on a level playing field, and blood testing helps with detecting banned substances.